Hello, reviewers. I'm very glad that I have this opportunity to present my thesis. My thesis title is Exploring Nursing Students' Perceptions of Patient Safety Culture in China. I will be presenting my thesis in 5 parts. Now I will introduce my thesis. Nurses' patient safety attitude is a key factor in ensuring patient safety. Cultivating the patient safety attitudes of nursing interns has become a key component of nursing education concerns in China at present. The researcher aimed to understand the correct status of patient safety attitudes of nursing interns and their influencing factors to provide a basis for patient safety education during the training phase of clinic internship, and to improve the safety attitudes and safety awareness of nursing students. And the problem statement is about nursing students' attitudes toward patient safety can be related to the lack of systematic patient safety education and the occurrence of nursing error incidents. This may lead to lack of awareness and diminished motivation in their patient safety attitudes. And the second is about given that nursing students are in the process of learning how to become healthcare professionals, their attitudes toward patient safety are crucial to ensuring that patients receive safe and high-quality care. In this context, nursing students therefore play a vital role in promoting patient safety. And my general objective is to determine perspectives from nursing students regarding attitudes toward patient safety in China. And the specific objectives, and the number one is to determine the demographic factors of nursing students undergoing the patient safety education. And the number two is to examine the nursing students' attitudes towards patient safety. And the number three is to examine the relationships between the nursing students' demographic factors and their attitudes on patient safety. So the research questions is about what are the social demographic factors of patient safety education for nursing students, and what are the nursing students' attitudes towards patient safety, and what are the relationships between the nursing students' social demographic factors and their attitudes on patient safety. And this is the literature review. It's a literature reviews all about my study. And now I will introduce the methodology. And this is a cross-sectional survey. The respondents were selected on the basis of random convenience sampling method. The total number of the respondents are 271. And my study location is in a senior nursing college in Sichuan province of China. And the study population is Year 3 Seminar 1 students. The sampling design is random convenience sampling, and the including criteria is full-time nursing undergraduates in school, having entered the training stage of clinical practice and having been in practice for more than 3 months, and informed consent to voluntarily participate in this survey. The excluding criteria is the sick leave during the collection, or withdrawing during data collection, or completion of the questionnaire with all answers being the same option, or take less than 10 minutes or more than 30 minutes to complete the questionnaire. And my instrument two is about the social demographic data as the patient safety attitude questionnaire and social demographic characteristics, and the independent sample t-test and a level for students' patient safety attitudes scores, and a univariate analysis of nursing students' attitude toward patient safety. So the result of the study is a total of 233 questionnaires were collected. The social demographic characteristics as shown. And according to the results of the questionnaire, the mean score for each of the 6 dimensions was 16.93, while stress perception had the lowest score of 27.4, indicating that the patient safety culture of students' perception of stress was weak. And based on the table 3, the results of the questionnaire were analyzed, and secting of the 13.1 entrants were below 17.5. With most of the low-list scores distributed in stress perception consistent with the results of average scores of the previous sex dimensions, in which nursing students were more prone to patient safety hazards, especially in the state of fatigue, loneliness, and high clinical loads, and in which nursing students found it very difficult to speak out freely about patient safety issues they encountered in the department. And from the table 4, we can see when comparing the relationship between social demographic information and patient safety attitude scores, the social demographic information that was statistically significant was whether or not the nursing students had received patient safety education and whether or not there had been an incident of nursing error during their placement. The results show that nursing students who had received patient safety education had higher positive patient safety attitudes, whereas those who had a nursing error incident had lower positive patient safety attitudes. Based on the above results, my discussion of this study is stated next. In my study, I think the majority of respondents agreed that receiving regular patient safety education was more conducive to equipping them with patient safety knowledge and being better able to respond to potential patient safety issues in clinic practice. The other way, in this study, 28.89% of training nursing students had nursing errors in their clinic practice, and nursing students who had experienced nursing error incidents had lower positive attitudes toward patient safety. These results suggest that more negative the students' attitudes towards patient safety, the higher the incidence of nursing errors. And the other side, in terms of specific patient safety attitude entrance, secting scores are below 17.5. 17.5, for example, in the stress perception dimension, the entry my work efficiency is inefficient when I am tired. So receive this knowledge score, and in the safety climate dimension, the entry it is very difficult to discuss mistakes openly in the department scores lowest. From this low-list scores, the internship hospital and department should establish a reasonable internship schedule system to reduce the work intensity and pressure of internship nursing students and to improve their patient safety attitude. So the conclusion is the results demonstrated that systematic acceptance of patient safety education and the effective avoidance of nursing error incidents were effective in improving nursing students' attitudes toward patient safety. And in addition, by improving safe working atmosphere for nursing students, such as avoiding long and intense workloads and encouraging practicing nursing students to participate in discussions on patient safety issues and to speak out bravely, the positive patient safety attitudes of nursing students can be effectively enhanced. Based on this study, I believe there are several other recommendations as follows. And these implications about the perception of patient safety culture is very useful to nursing students and nursing education research and the patient safety education. These are the references. Thank you for listening.